I want to turn now to Dr. Richard Besser. He was the acting director of the CDC in 2009 during the H1N1 pandemic. And he, along with other former CDC officials, is out with an op-ed in the Washington Post following Trump's order to hospitals to bypass the CDC, writing, quote, "We ran the CDC. No president ever politicized its science the way Trump has." Dr. Besser, it's great to have you with us. I think we'll begin generally with what prompted you to write this op-ed 4 months into this pandemic now.
You know, I think when you look at the response to this pandemic in the U.S., it is a disaster. And one of the big reasons for that is that, we have the world's leading public health agency, and they have not been in a position to lead. They haven't been out front talking to the public every day, explaining what they're learning and what people can do to protect their health. They haven't been supported by the leaders in the federal government to be in that mission. And what concerned us was that the CDC put forward evidence-based guidance around how to open schools safely this fall. And the concern is, when those guidance documents are put together, they go through clearance. Other agencies have an input. The White House has an input. And never in our years of working at CDC have we seen an administration take a guidance that had been approved and had been out there and undercut it and say that people don't need to follow the guidance from CDC. And so we're worried about what comes forward with new guidance and whether it will put children and teachers and staff at risk. And we want to show our support for the agency at the federal level that is trying to get this under control.
Hey, Dr. Besser, let me ask you, and if I can just push back on that for a moment, how would you rate the CDC's ability to withstand that pressure from the White House? Because as you mentioned, there have been 2 sets of guidelines issued by the CDC, one for reopening the economy, the other for schools, both of them not received warmly or even welcomed by the White House, publicly criticized by officials in the White House, only then to see the guidelines and Dr. Redfield amend some of the talking points around those guidelines. So how would you rate both Dr. Redfield and the CDC withstanding that pressure coming from the White House?
I mean, it is challenging. CDC is part of Health and Human Services, part of the executive branch, and that political pressure is really challenging. I mean, it's even harder when CDC is not out front with the public. And one of the things that I found in my years at CDC, I ran emergency response for 4 years. When you're talking to the public through the media, you not only have a chance to share what you're learning and what you're finding out, what people can do, and using that to build trust, you're getting tough questions. And those questions from the media help improve the work that you do. They don't let you move forward with things that may have more of a political overtone than they should. By asking those questions and the CDC being forced to answer those questions, it improves performance. And we're not getting that here. And so there have been a lot of stumbles, and we haven't been able to hear from CDC about why that's happening and what could be done to improve the response.
The big news today involving the CDC is that the Trump administration is ordering hospitals to bypass the CDC on COVID data. Why is that a problem from your expertise? The White House is saying it's to streamline information and make it faster so that there isn't a lag in real-time information. But how do you see it?
Well, I'm all about streamlining and improving systems, and we need to look to see what can we do to improve the systems at the federal, state, and local level. A lot of these systems are deficient because of the lack of investment in public health over decades. But what concerns me is that CDC, as our nation's public health agency, is where we've got the best epidemiologists, the best public health scientists. And we want them to be able to get this data and analyze this data and present it in a transparent way. We want them to get additional data so they can look at how this is playing out by race and ethnicity and by income. If the data are going directly to Washington, the concern is that the politics will come to play. An advantage of CDC being located in Atlanta, Georgia, is that it can stay away from a lot of the political pressure that you get when you're based in Washington. And given the amount of political involvement and interference that we've seen so far during this pandemic, the lack of data going directly to CDC, I think, is a red flag.
All right, Dr. Richard Besser, thank you so much for breaking it down for us this hour. I appreciate it.
Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us and we appreciate that.